Once again, I want to say that on behalf of Amref Health Africa, we are greatly honored to speak in this occasion. And I must say that Amref is an international organization that was founded over 64 years ago, actually exactly 64 years ago in Africa, and we are based in Africa. And we are proud to be here today because we feel so connected with you as an African organization headquartered in Africa and focused on health. So we are really feeling that we are part of the team with you in this journey. I want to go straight away to, first of all, acknowledging the senior members who are here in this conference today. The Minister for Health Uganda, I know this one is hosted in Uganda, Dr. Ruth. I also want to acknowledge the Vice Chancellor, Professor Malata. It was really nice listening to you and learning that your background is nursing. The Deputy Vice Chancellor, Eden University in Zambia, and the Regional Director, medical students, student leaders, and the distinguished medical students of Africa. I'm glad to be speaking to you today. I'm speaking to you on behalf of our group CEO, Dr. Githinji Gitahi. I'm sure you can actually Google and you will find Dr. Githinji Gitahi. He's the group CEO of Amref Health Africa. Amref is a big organization. It has several arms. One of the arms of Amref is the university. The other arm of Amref is the flying doctors. So you can see that we are truly interconnected with you in this journey to realizing universal health coverage. So I want to go straight to my talk just by reminding our students here who are our future healthcare leaders. Really, the tie between universal health coverage and what it is that this movement is about, which I really wish to congratulate the Federation for taking the lead, because I am so encouraged. Actually, when I was reading the papers, I am so encouraged that we are going to have a generation of health workers that who already know the most important thing. Unlike the generation Professor Goma talked about, the generation that was looking at patients as probably specimens or something else. So we are going to have a generation of health workers that is starting from the right platform. So I want us to remember the key focus of universal health coverage. It is people-centered primary health care. And the focus is not just about treating disease, but it is also about helping the general well-being. So therefore, when I was preparing this talk, I talked to some of the senior doctors who've been in practice for many years. I'm a public health person myself. And patient-centered care is the only approach. There is no other. If there is anything else you have to remember as you grow into the field, there is no other approach. Because health professionals are trained and they exist because of patients. So I want to encourage our young people, our future doctors, we shall definitely land into your hands one point or another. It is the only approach. There is no other. I want to talk about what Amref is doing in UHC. Amref is in several African countries. We are in Malawi, we are in Uganda, we are in Tanzania, we are in Senegal, and we are in Zambia, we are in Ethiopia, we are in actually over 13 African countries, and we have footprints in 34 African countries. We are focusing on priority areas for the African region. And that is why I'm saying we are so interconnected with you. We are also meeting the country needs and aligning into the corporate strategies. In every country we are working with the Ministry of Health. I'm sure the Minister for Health Uganda knows our meetings with the Ministry of Health Uganda and our interaction in working together. We are focusing on community-centered, and that is the key word that we really have to take today: centered, patient-centered. So whether it is community-centered, whether it's patient-centered, that is the key word. One of the things Amref is also doing is establishing the youth as a clear emerging priority. You belong to that group. In fact, in June, 16th of June, we launched the Global Youth Strategy, which I'm going to talk to you about so that you know that we are concerned about your generation. We are concerned about the young people because they're the next. The other thing that Amref is doing, it is also training health workers in the areas of preventive. We are training nurses in the areas of curative. We are training nurses in the area of preventive. We are also curative, I'm talking, sorry about that. We are also having preventive sciences in the areas of public health, community health. We are having rehabilitative medicine where we have physiotherapy, mental health through the university. The university actually is responding to one of the pillars of the larger Amref, which is human resources for health. And that is where this meeting today is anchored. You are the human resource for health for the future generation. What are we doing about the youth and UHC? As I said, we just launched the youth strategy. What is the youth strategy about? The youth strategy is quite ambitious. In fact, if you go online and look for this strategy, it's titled Above and Beyond with African Giants, because you are the African giants. Our young people here, our future health workers here, you are the African giants. So the Amref Global Youth and Adolescent Strategy has 3 pillars. One pillar is advancing the youth agency in health. So there is a role for you to be involved. There is a place for you in growth. The other pillar in this strategy is looking at data for action for youth-led programs and policies. Youth-led programs and policies. That tells you that we recognize how important young people are in advising programming, in developing policies and implementing them. The other pillar is maximizing youth potential and minimizing youth vulnerabilities through programs, learning, and strategies. So I want to encourage you today that the youth are not only the leaders of tomorrow. We used to say the leaders of tomorrow. They're the leaders of now and tomorrow. This strategy is actually looking at collaborative youth leadership for lasting health change in Africa. We welcome you to work with us. We welcome you to contribute. We welcome you to lead. This is an organization that is focused on health and has recognized really the importance of young people forming half of the world population. And I was hearing that in Uganda, actually probably over 70%. And just to come to what you are addressing today, patient-centered to achieve UHC. It has already been said, and I don't want to repeat what has been said because I've seen that Professor Malata has addressed this issue, Professor Goma has addressed this issue, but I just want us to remember that the patient comes to the doctor in complete confidence that they will get help. So I want you to imagine somebody coming to you in complete confidence that they will get help. Remember that the patient is the boss. And Dr. Goma has already alluded to this point. Sharon has addressed the issue of we are human beings. So it's important that we recognize the aspect that the patient is such an important person. It's important that you address them by name, you listen to them, you touch. I remember talking to a friend of mine some time back, and she was like, I want to go to a doctor who will actually examine my child. So you are going to a generation, you are the generation that is going to make this change. As I come to the last part of my talk, I want to tie up the issue of leaving no one behind. So my take-home message from Amref to all of our students today is young people form half of the world population. That means you are really important. That means you have a significant role. We must also remember that Africa has trained health professionals and they are inadequate. We acknowledge that. Professor Malata has already talked about this. But I want to challenge us as future healthcare workers. Why are we having our patients going to seek healthcare in Cuba, in India? And they come back with a different experience. You are the generation that is going to change this. Why are we having that? Africa must change, and you are the generation that is going to change them. It is not business as usual. Remember that you are going to deal with a population that is dynamic. As has been said, you're going to deal with a population that is well informed, that knows that their oxygen level is this much. That means is a good thing, is an opportunity because the patients seek healthcare earlier. However, it is also a challenge because when you are dealing with a well-informed person, it means that you also have to be well-informed. You need to up your game. You need to grow your skills. There is no sky, definitely, and there are no borders. And this is why I'm talking from Nairobi, and Professor Dr. Goma is talking from Zambia. So I see a generation that is going to work together so that we don't have this flow of patients to other countries when we have all these professionals here. I want to encourage you to seek partnerships. I want to encourage you to seek for opportunities to collaborate and learn from other fields. This is one area that health workers are weak at. They are weak at skills that will help them to propel, to grow their skills beyond medicine and nursing. Grow your skills in financial management. Learn what goes on in financial management. Grow your skills in communication. Grow your skills in seeking opportunities for resource mobilization. Africa needs you. Develop a culture that is patient-centered so that we don't have to go elsewhere to seek healthcare when we have all this big population, because we can change this together. Thank you very much. I wish you well. I just want to remind all of us, let us connect, let us collaborate, and patient-centered care is the only approach. There is no other. Thank you.